Let's go to the phones.
Yeah.
Good morning, KUGN News Talk 590. Who's this?
This is Dr. Chicola.
Hi, Dr. Chicola. How are you this morning?
I'm just fine.
All right, we've got Dr. Chicola on the. We are going to switch gears here, just like that, in midstream, because I saved you, Al. It's your fault.
It's my fault. It's
Dr.
always
Chicola,
my fault.
we've got Dr. John in studio. We're talking with him. We've got a trivia question on the line for our listeners, and we're gonna turn our attention to bone density this morning. Is that right?
Absolutely.
But I think we should ask
Dr. Chicola.
Dr. Chicola our trivia
So go
question.
ahead.
That's right. Go ahead. Kathy, the trivia question this morning is, how much does the average human heart weigh?
Average human heart weigh, I'd say a pound and a half.
Oh.
Yeah, well, you're getting close.
Oh, wow. So it does weigh less. So our
It does,
first.
yeah, it does weigh.
Except for me, I have a big heart. Mine's
Yes,
20
you
pounds.
do.
Yeah,
Yes, you certainly
We've
do.
heard that about you.
Anyway, sorry for the diversion.
Dr.
You're not going
Chicola,
to tell me the answer?
He doesn't. He lets
You
it
gotta
go for a
listen.
little while.
You have
'cause
to
our
keep
listeners-
listening to the show.
Yes.
it's a tease.
Oh, I have to work, unfortunately. You're going to have to tell me later.
off
Wait,
the
she
air,
was
I'll
just
tell
going to
you.
say for crying out loud.
For crying out loud.
All right.
She's a radiologist, works at Oregon Imaging Center's Director of Women's Imaging. Glad to have you on the show here in Doc Talk with Dr. John Latosky and Storm Now. Good morning to you.
Thank you. Good morning.
Tell us about bone density recommendations. Have they changed over the years, or what are they now? What's going on with that?
They have. Back in 2002, the U.S. Task Force was recommending that women over 65 or anyone 60 to 64 female with risk factors should get a bone density test. But I think the task force has realized that this is a huge public health concern, and now the recommendations are that women who are postmenopausal at any age or over 60 with risk factors or men over 70 should all be tested to see if they have osteoporosis. So this has been a change. They've ratcheted it down for women. The male recommendations are the same over age 70.
So you always hear, though, at least I do, that osteoporosis is mostly more common in women, but it does happen to men as well.
It really does. Although 80% of the Americans with osteoporosis are women, there is 20% out there, and they are men. And it's a huge problem just because of the fracture risk. A quarter of people with hip fractures over the age of 50 die within a year of having their hip fracture, which is kind of an astounding statistic and very scary to me.
Sure. What are some of those risks, Dr. Chicola?
Well, the main ones are obviously being female, aging, family history, but also low calcium diets. And the concern now is that our diets are so high in protein, sodium, and caffeine, and all of those are risk factors for osteoporosis. Also, being inactive. The recommendations are for weight-bearing or strength training exercises, smoking, the usual, alcohol abuse, but also being small and thin and having a family history of osteoporosis or a personal history of a fracture. And in women, a low estrogen level, such as postmenopausally, and also for men, anything that lowers the testosterone level can increase your likelihood of osteoporosis.
There's something like supplements, like bone calcium supplements. Would that help you?
Absolutely, absolutely. Calcium and vitamin D, particularly here in Oregon, where we tend to have low vitamin D levels because we don't give it as much sun exposure. Definitely a supplement of calcium and vitamin D will absolutely help. The thing is that, you need to start this early, too, because about 90% of your adult bone mass is set down in girls by age 18 and in boys by age 20. So it's very important to try and get the daily recommended amounts of calcium and vitamin D, starting as a child, basically, and exercising, and try to avoid smoking and excessive alcohol.
Kathy, these recommendations talk about this particular type of bone density screening called a DEXA scan. What about other versions, the ultrasound, the PIXI scan?
The PIXI scan and the ultrasound, or what we call peripheral techniques, where they'll take a wrist, or the ultrasound in particular does your Achilles tendon. The DEXA scan, though, measures your central bone density, and what it does is it measures the places that are most likely to fracture. It measures your hips, your wrist, your spine, and also the places that you have the most debilitating fractures. I know spinal fractures, and if you think of any old older people that you know who have had hip fractures. They're very, very scary. So the DEXA scan takes a combination of spine, wrist, and hips and gives you a number called a T-score that tells you where you are in terms of your risk factor. So they're very accurate, and they're much more attuned to where the fracture may actually happen.
Yeah.
So, doctor, how frequently should someone get the simple osteoporosis test? Once a year?
Well, no, not really. Initially, the recommendations are women over 50 with risk factors, any postmenopausal women, and men over 70 should get an initial screening study. And then depending on what that finds, what we recommend, the International Society of Clinical Densitometers recommends that particularly if you're being treated, let's say you have a very low bone density and you're being put on a medication for it, the recommendation is that you have a repeat study in 2 years. But you know, the problem is trying to get people in for those initial screening studies so that they can find out if they have osteoporosis in the first place.
All right, Dr. Cathryn Chicola, Oregon Imaging Center's Director of Women's Imaging. Thanks for being guest here on Doc Talk on KUGN. How can folks find out more information about this?
They can go on our Oregon Imaging Center's webpage. We have a lot of information on that. And also the International Society of Clinical Densitometry. I know it's a big, long word, but they have a lot of very good information. But check out the Oregon Imaging Center's website because we have some good stuff on there.
Interesting stuff. Dr. Chicola, thanks for being guest here on Doc Talk with Stromanel and Dr. John here on KUGN.
Thank y'all.
All right, it's 8:23 now at KUGN.